Did you know that your liver performs more than 500 essential functions every single day? Even while you're sleeping, your liver is filtering toxins, processing nutrients, producing proteins, regulating blood sugar, storing vitamins, balancing hormones, and helping your immune system fight infections. Yet despite being one of the hardest working organs in your body, the liver rarely complains. Unlike your heart or lungs, the liver has very few pain-sensitive nerves. This means serious liver damage can silently develop for years before noticeable symptoms appear. What does the liver actually do? Detoxification produces bile, stores vitamins A, D, E, K, stores glycogen, processes fat, produces cholesterol, makes blood-clotting proteins, regulates hormones, supports immunity, metabolizes medications. Without a healthy liver, almost every organ system suffers. Many people don't realize they have liver disease until they are diagnosed with fatty liver, hepatitis, cirrhosis, or even liver cancer. According to the World Health Organization, liver disease affects hundreds of millions of people worldwide and causes millions of deaths every year. The good news, most liver diseases are preventable. And even if liver damage has already begun, early treatment and healthy lifestyle changes can often stop or slow its progression. In today's video, you'll discover what the liver actually does, what causes liver disease, the warning signs you should never ignore, the different stages of liver damage, the best foods for liver health, medical treatments available today, daily habits that can protect your liver for life. Stay until the end, because we'll also share simple habits that can dramatically reduce your risk of liver disease.
Have you ever wondered how the liver, weighing only about 1.5 kilograms, 3.3 pounds, can perform more than 500 vital functions every single day? That's because the liver operates like an extraordinary biochemical factory, where billions of liver cells work continuously 24 hours a day, even while you're asleep. At the same time, the liver functions as a remarkable protein production center. It manufactures albumin, a protein that helps maintain the proper balance of fluids in the bloodstream, as well as clotting factors that stop bleeding when you're injured. The liver also produces numerous transport proteins that carry hormones, vitamins, minerals, and other essential substances throughout the body. One of the liver's most impressive responsibilities is detoxification. Every day, our bodies are exposed to harmful substances from alcohol, tobacco, medications, processed foods, environmental chemicals, and even natural waste products created during metabolism. Using a highly specialized enzyme system, the liver converts these potentially harmful substances into less toxic compounds, which are then eliminated through urine or bile. However, when the liver is exposed to excessive amounts of toxins over many years, its detoxification system becomes overwhelmed. Gradually, liver cells become damaged, inflammation develops, and the risk of chronic liver disease increases significantly. The liver also continuously produces bile, a greenish-yellow digestive fluid that is stored in the gallbladder. Whenever we eat foods containing fat, the gallbladder contracts and releases bile into the small intestine. Bile breaks large fat droplets into much smaller particles, making them easier for digestive enzymes to process. This process also allows the body to absorb essential fat-soluble vitamins, such as vitamins A, D, E, and K. In addition, the liver serves as the body's primary storage center for many important vitamins and minerals, including vitamin A, vitamin D, vitamin B12, iron, and copper. Whenever the body requires these nutrients, the liver releases them into the bloodstream to support normal physiological functions. One of the most extraordinary features of the liver is its remarkable ability to regenerate itself. If part of the liver is damaged or surgically removed, the remaining healthy liver cells can multiply and restore much of the lost tissue. Very few organs in the human body possess this incredible regenerative capacity. Unfortunately, continuous damage caused by excessive alcohol consumption, hepatitis viruses, fatty liver disease, obesity, or long-term exposure to toxins can eventually overwhelm this natural healing process. Healthy liver cells are gradually replaced by scar tissue, leading to liver fibrosis and eventually cirrhosis. Once extensive scarring develops, the liver loses much of its ability to regenerate, and its vital functions begin to decline. Every second of every day, your liver is silently working behind the scenes, filtering blood, processing nutrients, producing energy, manufacturing proteins, creating bile, storing essential nutrients, and removing harmful toxins from your body. It asks for very little in return. That's why protecting your liver isn't simply about caring for one organ. It's about protecting your overall health, your energy, your longevity, and your quality of life. Every minute, approximately 1 to 1.5 liters of blood flow through the liver via two unique blood vessels, the hepatic artery and the portal vein. The hepatic artery delivers oxygen-rich blood to nourish the liver cells, while the portal vein carries nutrients that have just been absorbed from the stomach and small intestine. As blood enters the liver, billions of liver cells begin an incredible quality control process. Nutrients such as carbohydrates, proteins, and fats are carefully sorted, processed, and distributed throughout the body according to its needs. Excess glucose is converted into glycogen for storage, and when blood sugar levels fall, the liver breaks glycogen back down into glucose to provide energy. This is why the liver plays such a crucial role in maintaining stable blood sugar levels.
Explain the definition. Different types: fatty liver disease, alcoholic liver disease, viral hepatitis, autoimmune hepatitis, cirrhosis, liver fibrosis, liver failure, liver cancer. Explain that liver disease develops gradually over many years. Explain non-alcoholic fatty liver disease, NAFLD, alcoholic liver disease, risk factors, obesity, diabetes, high cholesterol, high sugar intake, lack of exercise. Mention that fatty liver often has no symptoms. Major causes: alcohol, poor diet, obesity, diabetes, smoking, hepatitis B, hepatitis C, certain medications, drug abuse, chemical exposure, environmental toxins, genetics, autoimmune disorders, poor sleep, chronic stress, loss of appetite, nausea, bloating, upper right abdominal discomfort, dark urine, pale stools, yellow skin, itchy skin, easy bruising, swollen legs, mental confusion. Explain why symptoms appear late. Scene 7, how liver damage progresses. Healthy liver. Fat accumulation, inflammation, fibrosis, cirrhosis, liver failure, liver cancer. Explain each stage visually. Foods that help protect your liver. Leafy greens, broccoli, garlic, turmeric, green tea, coffee. Fish, olive oil, nuts, beans, whole grains, berries, citrus fruits, and water. Antioxidants in these foods neutralize harmful molecules, reducing liver inflammation. Avoid excessive sugar, soft drinks, alcohol, and processed meat. Deep-fried foods, fast food, trans fats, excess salt, and highly processed snacks. The liver is the only organ that can fully regenerate itself. Liver recovery is possible if damage is caught early enough. Understand the progression from fatty liver to fibrosis, cirrhosis, and ultimately liver failure. Medical diagnosis involves blood tests for liver enzymes and imaging like ultrasound, CT, or MRI. Advanced tests like FibroScan and liver biopsy provide deeper insights. Early screening is critical to prevent irreversible damage. Treatment depends on cause. Lifestyle modification, weight loss, exercise, antiviral medications, stopping alcohol, managing diabetes, controlling cholesterol, vitamin support, liver transplant. Explain there is no single miracle cure. Healthy weight, 30 minutes exercise, drink water, sleep 7-9 hours, avoid smoking, limit alcohol, vaccination, avoid unnecessary medications, wash hands, safe food, regular checkups, stress management. Myth 1, only alcohol causes liver disease. Truth, fatty liver is now more common. Myth 2, Herbal supplements always protect the liver. Truth, some herbs can actually damage the liver. Myth 3, no symptoms means healthy liver. Truth, many liver diseases remain silent for years. Myth 4, young people can't develop liver disease. Truth, childhood obesity has increased fatty liver dramatically. Your liver works tirelessly every day, quietly supporting nearly every function that keeps you alive. Yet it often goes unnoticed until serious damage has already occurred. The encouraging news is that many liver diseases can be prevented or even reversed in their early stages through healthy habits, balanced nutrition, regular exercise, limiting alcohol, maintaining a healthy weight, and getting routine medical checkups. Small choices made consistently can have a profound impact on your long-term liver health. If you experience persistent fatigue, yellowing of the skin or eyes, unexplained weight loss, swelling, or ongoing abdominal discomfort, don't ignore these warning signs. Seek medical evaluation promptly. Early diagnosis often leads to more effective treatment and better outcomes. Remember, the information in this video is for educational purposes and should not replace advice from a qualified healthcare professional. If you have concerns about your liver health, consult your doctor for personalized guidance. If you found this video helpful, please like, subscribe, and turn on notifications so you never miss our latest evidence-based health content. Share this video with your family and friends. You could help someone recognize a problem early and protect their health. Thank you for watching. Stay healthy, take care of your liver, and we'll see you in the next video.